This is, we believe, a fairly unique approach to treating oral mucositis. The drug itself targets the innate immune system and the sentinel cells, which are sort of the heart of the innate immune system. This immunity is not the typical adaptive that we usually think about, which has to do with antibody formation, etc. It's the very primitive system which reacts to both damage as well as microbial invasion. So that it acts very quickly within minutes to hours after the event. And basically what happens is that a number of cells, both in the circulation as well as in the tissues, will react to certain what have been called danger molecules. When these are present, they integrate a lot of the signals and decide how that innate response is going to behave. You can have a lot of inflammation, you can have recruitment of a variety of healing cells, if you will, as well as the ability to increase fighting off microbes. So that basically these cells figure out what is going to be the most adaptive system. Unfortunately, when you have radiation chemotherapy, you have a lot of tissue damage, the innate immune system says, oh, this is like a physical problem, and it focuses a lot on inflammation. If this were a simple being hit by a stone, that's exactly what your body needs. The problem is in this situation where you have chemotherapy or radiation therapy, what happens is it actually aggravates the initial destruction of the lining of actually any highly dividing cell. And so by focusing the response away from inflammation and more towards healing and fighting off infections, does several things. First of all, it prevents this downward cycle of damage causing inflammation, causing more damage, which ultimately leads to these large ulcers. Second of all, by increasing the host responses, it prevents secondary infection of these open sores in the mouth, which is a large source of infection in these sorts of patients. And then, even if an ulcer does develop, by enhancing wound healing, we decrease the amount of, or the size of the ulcers which actually show up. So now, I've said all of this like we know that this is going to happen. We know this happens in animals, and like any pharmaceutical company, we're looking to try to prove that in patients, which is why we're running a trial here in the US.